I'll get started. So today's the respiratory and digestive system, as the presenters were showing. And yeah, we just did the organ system spotlight. We're going to do the terminology for respiratory system, then digestive system. And if time, and since I know like a lot of people who didn't get the chance to look at the case report yet, I might or might not do the review for case report for, okay. So bronchi-O. I think this one's pretty straightforward. It's a combining form that means bronchial tube, bronchus. So bronchus would be this one broncho, and bronchi is like the plural. So one example is bronchoscopy. So broncho, combining form plus scopy, like visual examination. So visual examination of the bronchi. You would insert like a catheter from your like mouth or nose like through down to like a bronchi and like inspect if there's any like a blockage that you want to remove. I think you can use the catheter to just physically push out like any obstacles that might be in. And so that at the top is like the trachea. It comes down and like branches into bronchi. Those are like the, I guess, more wider uh of like those tubes, and then it can branch even further into like smaller branches of bronchioles. This probably will be more like a review of like a high school bio probably. um Laryngo is a combining form that means larynx or throat. So larynx, as the presenters were mentioning, it's the portion of your throat that connects from the mouth. So like this area kind of is like the larynx. It's also called the voice box because that's also where the voice cord is. And actually, it's not just direct only connected to the mouth. It is also connected to the pharynx, which also leads from the nose. There's like a connection here, so it can also help in controlling like which one goes to your trachea, which one goes to your esophagus, so you don't accidentally eat through your trachea when you're supposed to like breathe through it. Yeah, and one example is otolaryngology. So oto is a combining form that means ear. Otoscope, it's like a scope that inspects like your ear. Laryngo is a combining form. Oh, it was larynx, and ology is a suffix that means study of. So otolaryngology. It's a study of ear, nose, and throat, also called ENT. It's the same thing. Hello. Uh, and pharyngo is a combining form that means pharynx. So it's a larynx and pharynx like sounds very similar, but you can kind of think of it as like a larynx is more of your mouth and like vocal cords. Pharynx is more of your nose and uh, esophagus, like heading to digestive system. So that was larynx right there, and pharynx is that color coded portion, like the yellow, green, purple. That portion is the pharynx. So it's mostly connected to your nose, and it is also involved in controlling which one goes to esophagus versus which one goes to trachea. So that's pharynx. And one example is pharyngitis. So pharyngo plus suffix itis, inflammation. So inflammation of the pharynx. That's pharyngitis. And naso is a combining form that means nose. I think this one's pretty straightforward too. So one example is nasopharynx. So naso, nose plus pharyngo, which meant pharynx. So nasopharynx is this yellow portion of the pharynx at the very top. It's the upper part of the throat located behind the nasal cavity. So that yellow portion would be nasopharynx, and this green portion would be called oropharynx, because oro is a combining form that means mouth. Oral, that would be like one example. So oropharynx, and then hypopharynx. Hypo, if you remember, it's like below something, like opposite of hypo. So hypopharynx is like the lowest portion of the pharynx. And yeah, this one has a lot of variation, but you just have to know like that ox is uh, the main part. So oxy, oxo, oxi is a combining form that means oxygen. So one example, hypoxemia, hypo, we just said it's like below something or deficient. Oxo plus suffix amia. Amia, if you remember from last lecture, was any kind of blood condition. It's called amia. So hypoxemia is a abnormally low level of oxygen in the blood specifically. If it's just like low oxygen level in general, we'll call it hypoxia, like hypo plus oxygen, yeah, hypoxia. But if it is specifically referring to like how much oxygen your red blood cells have, it would be hypoxemia. And phone O is a combining form that means sound or voice. Um, so one example is dysphonia. So dice is a prefix that means bad or difficult. And phono plus suffix ia, which was a condition. So dysphonia means difficulty producing voice or sound. And this is also known as hoarseness. Dysphonia and hoarseness is like the same thing. And that usually happens because your vocal cord is inflamed. So physically, like the inflamed vocal cord can like just uh, push those two lips together, so like they can't like open back up or like close that well. It becomes like really stiff and rigid, so you can't speak that well. Hoarseness. It's also one possible symptom of a asthma attack too. If you have like very severe one, it can like spread to like up there to like vocal cords as well. Pleuro is a combining form that means pleura. So pleura, I'm not sure if I'm pronunciating right, but pleura, I think pleura is the right one. Pleura is these blue and green membranes that surround the lung. So the green one is called the visceral pleura. It's like the inner portion of the membrane, and parietal pleura is like the outer portion. And those membranes, pleura, kind of like surround the pleural cavity where the lung is. Yeah, kind of like that. So pleura is the serous membrane that surrounds the lungs. So pleurisy is one example. Pleuro plus suffix ici. I think this is like a new one. Yeah, ici also means like any kind of condition or disease. So pleurisy is inflammation of the pleural membrane. And sorry if I'm going too fast. Just feel free to stop me. I know you guys are like I can hear you guys like typing, and I feel like I might be going too fast. So let me know. And uh, if you guys, I think you guys might have heard the notion like someone's like lung collapsed. So can anyone explain like what collapse of the lung is? Maybe like how that happens? Yeah. Taking it. Yeah, exactly. It is also like the partially if it's like functional, but like can like still take some, but like not very well. That's also called like a lung collapse. But yeah, that was exactly it. And a very common cause of it is oh, in the medical term it's called pneumothorax. When you say collapsed lung, so pneumo kind of more like your uh lung. It's like a combining form that means lung. Thorax, uh hmm, I think we'll go over thorax like later, so I'll just skip that. So as you can see, that lung is like very shrinked, and one biggest mechanism that could happen is like you have a puncture in the pleural membrane, so you can't keep the pressure. So like pleural membrane and the lung has like some air space in between, and that's pressure of air kind of like keeps the lungs like shape intact. Like when you're breathing in, that space is like not gonna expand or like get pressured too much, so like it will move along with the lung. That makes it possible. But when you have a puncture in the pleural membrane, that air pressure is gone. Like that portion like cannot. So even if you move the muscles, like your rib muscles, to like expand your lung, that air pressure does not exist. So your lung just stays the same. That's where usually how like the lung collapse happens. And yeah, I think here it says too, like air-filled pleural space. So yeah, that's one big implication of pleura. Oh, this one's cool. See like an X-ray image of collapsed lung. Wow, this one's crazy. So I assume uh, this portion is supposed to have lung, but it got very what's it called? Collapsed that like it just lost all of it. And suffix apnea is a suffix that means breathing. So one example is apnea. A is a prefix that means without, plus apnea. Apnea is temporary absence of breathing. And similar but different term is dyspnea. So dice, we said it's like bad or difficult of something, plus suffix pnea. So dyspnea is a shortness of breath. So those are very similar conditions, but apnea is more like you actually can't breathe for like a few moments. But dyspnea is more like you kind of like have like very obstructed breathing, but you can still like breathe a little bit. So sleep um sleep apnea is when you're sleeping, you this is also like a symptom. Oh, okay. When you're sleeping, like your airway might get restricted, and you might get temporary absence of breathing through that. A lot of people snore when this happens because snoring is actually like a body's mechanism to actually help bring the air in. It's like forcing your muscles to move so that like air can come in when there's like an obstruction. So yeah, um, pneumo, pneumono, or prefix new all means lung or air. Oh yeah, it could also mean air. Um, so one example is pneumonia, pneumono plus suffix ia, which is infection of the lungs. Um, most likely resulting in inflammation. So when you have, so those were the alveoli we were talking about. They're like a kind of grape looking like small ball sacs that have like very high surface area for like easy gas exchange. So alveoli usually looks like that, no fluid, because like you don't want there to be fluid if you want to directly exchange gas with the air environment. Um, but pneumonia, the inflammation, and you might get some like pus or liquid filling up in the alveoli that might result in fluid filling. And this can either result in more inflammation or obstructive breathing, or you might cough out pus, that kind of thing. So pulmo or pulmono is a combining form that also means lung. So one example is a pulmonologist, pulmono plus the suffix ologist, that means specialist. So pulmonologist is a physician specializing in lung diseases. So sinus, O is a combining form that means sinus. So sinus are this red highlighted areas, kind of like spread throughout your face. It's more so like all connected to your nose. So there's like a maxillary sinus that's almost like right lateral to the nose, and there's like a frontal sinus that's on your like forehead region, and also kind of like almost near to your ear. There's also like a sphenoid sinus, and sinus is a very what's it called? Is a very it's a part of your body that's very prone to like any kind of inflammation or like immune attack. So a lot of people who have like autoimmune problems also have a problem with the sinus. Like fluid fills up in the sinus either, or like it gets inflamed and like puffs up. That happens a lot. So one example is sinusitis, which was I was mentioning. It's inflammation of the sinuses. Yeah. And somno is a combining form that means sleep. So insomnia, that's like one example of how somno is used. So polysomnography. So poly, which means many of something. Somno plus graphy, process of recording. So polysomnography is a comprehensive recording of sleep-related parameters during sleep study. You might have seen like a kind of like the neural impulse curve of like a REM sleep versus like a non-REM sleep, R1, R2, R3. Those will be measured using polysomnography or EEGs. But in like a either academic study or some kind of like clinical study, people who volunteer to have their neural impulses recorded, and they have to get connected with so many patches and wires that will like detect their neural impulses. And you might notice like some are even like in their jaw or like different parts of your body, not like specifically brain, because your brain is actually indeed three-dimensional. So like thing that's like very at the core of your brain can be felt here, 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 anywhere. Uh, Spiro is a combining form that means to breathe. So spirometer is one example. It's a spiro plus meter. Like you can think of just the unit meter, and that means measure. Spirometer is an instrument used to measure breathing volumes, and the diagram shows like kind of usually how it goes. Usually put like a clip-on nose to prevent breathing through your nose, only through your mouth, and the nurse or MA will instruct you to kind of like take normal breathing, and then when it's ready, take like a deep breath and like push out as fast as possible to one, see how big of a volume you can inhale and also exhale, and two, is there any obstruction while you're exhaling? That can also be, it's let me show you. um, let's see. Yeah, it kind of goes like this. So like while you're inhaling, the curve kind of goes like this, and then like deep breathe and expire. So it should look like a straight line. If there's like a lot of like wiggly lines, that means like there's some kind of obstruction that could mean there's some kind of either inflammation in your lung or like an airway. And uh, thorac O, uh, or prefix thorax, is a combining form or prefix, or sorry, suffix that means chest or pleural cavity, kind of referring more to like a, actually, yeah, I think it's used evenly as like both chest and pleural cavity, kind of like a, just that whole like upper region that includes your lung, that's referred to as like a thorax. And uh thoracentesis is one example. Thorac O plus centesis, which is a surgical puncture to remove fluid. So it's a removal of fluid from the pleural cavity by creating a surgical puncture. So this would be more like a controlled way of having like a puncture in your pleural cavity. If you just like do it normally, then you might have like a lung collapse. But so you, with like a big needle on like syringe, you make a puncture and actually just like drain out the liquid that's filling the pleural cavity in that region between the membrane, the pleura, and the lung. There's like some fluid filled up. because of like inflammation or something. So you like actually remove the fluids through that. It's called the thoracentesis. Um, Tracheo, combining form, or trachea. That should be suffix. My bad. Um, is a combining form or suffix that means windpipe or trachea. Trachea is also called windpipe. Um, Tracheostomy is one example. So tracheo plus stomy, remember, was like a suffix that means surgical creation of some opening. So tracheostomy is a surgical creation of a permanent opening into the trachea. You might have seen a lot, like they make a opening in your throat for people who can't like breathe on their own. So it directly connects to your trachea under your lung, and you can mechanically supply air and like exhale back out for them. Okay, so I will move on to the digestive system terminology. Um, any question or like something you guys want me to clarify before I go on? Good. Okay. Uh, yeah, that would hurt. Probably probably they anesthetized locally, maybe, hopefully, before doing that. Uh, Ano is a combining form that means anus or ring. Um, so one example is anoscopy. Ano is a combining form, and then scopy, visual examination. So visual examination of the anal canal and the lower rectum. So it's like a similar tool that you use when you do like a woman's like vaginoscopy, but you actually, the tools are shaped like that so you can like uh you going in part is like narrow, it gets like wider, so you can actually like physically widen up as you go in, and either the doctor or like the person who is looking from here, like if there's any like either like parasite. I don't think that's like the things they're looking for, but mostly some kind of like polyps or some kind of mass tumor growing. Because a lot of times, oh yeah, I think this one is the example too. It has like a tumor, and so if they do it this way, they definitely won't be able to see the tumor. But actually, never mind. If this is like a transparent scope, then they would probably be able to see. But anyways, your rectum or anus, that area is like a site where a lot of cancer happens, like especially the epithelial lining of it, like a colon cancer can happen on like your rectum. Um, and as I said, this kind of connects to why you get so many inflammation in the GI tract, uh, because it's like the first contact that your body comes in with like the external environment, carcinogens and mutagens, all those like bad things that could cause cancer will first expose those epithelial linings of your GI tract. Um, no worries. So procto is a combining form that means anus and rectum. One example is proctologist. So proctologist, procto plus ologist, which was specialist. So specialists, proctologists are specialists in disorders of the anus and rectum. And oh, I mean, you guys probably know, but I just wanted to clarify. Anus is like the very end, and the rectum is like right before that. Okay. So rect O is a combining form that means rectum, or it also means straight. One example is rectocele. So recto plus cele is a suffix that means hernia. So hernia is a condition where part of your organ protrudes through your muscle wall. So, for example, like in this diagram, your um, rectum should normally look like this, but it kind of like protrudes out and tries to like touch this area. That's like some kind of hernia. It can be like internal like that, or it could also be external. Um, a lot of times, like your I don't know that well for like human case, but uh, when I was working with the dogs, the veterinarian I worked with always told me the dogs and cats a lot of times get like a umbilical hernia. They're uh, when they were born, like their umbilical region, one of the small intestines, be it some kind of like digestive organs, can like protrude out through your that umbilical area, and that's like one condition that needs to be treated before doing like spay or neuter, if I remember right. So yeah, those are hernia. And oh, and if if you want to refer to it as like a there, this is like having like a hernia. We'll call it like a that is having herniation. And so rectocele is a hernia-like bulging of the rectal wall into the vagina. Yeah. So when combining form is sigmoid, sorry, the sigmoid O is a combining form that means sigmoid colon. So this is like not very like I guess high, very demanding knowledge, but sigmoid colon is like before your rectum and below the descending colon. It's like the kind of like the one of the last parts your colon goes through, ascending, transverse, descending, and then sigmoid colon, then rectum and anus. So sigmoidoscopy is a one example. Sigmoido plus suffix scopy. So it's a visual examination of sigmoid colon. Um, I assume it's more so of like if you have either constipation or diarrhea. I'm more like constipation. Then you would do like sigmoidoscopy to like see if that is really the case and things are okay. Col E is a combining form that means bile or gall. So one example is cholangitis. It's a col E plus angio. If you remember from last lecture, it was like a blood vessel is referred to as I mean any kind of vessel is referred to as angio, and itis inflammation. So cholangitis is the inflammation of a bile duct. So duct here is like referred to as vessel, angio here. So Bile duct is that portion that's like highlighted in like a rectangle. It's the connection from uh, your liver to, or actually, it could also be from your gallbladder to the small intestine. I think that whole portion is called uh, bile duct. And normally, your bile duct would look um, just normally like that. But if it's inflamed, it can have like those bulges in between here and there. And since you guys remember, bile duct is important in bringing the, not solutions, but yeah, the bile salts. Is that right? Yeah, it's the bile into small intestine to help break down the fatty acids in the small intestine. So if you have a problem with the bile duct, you probably have a hard time breaking down fats. Um, Suffix lithiasis is a suffix that means presence of stones. So you probably remember there was like term, I think like in the first lecture we're talking like there's like two meanings of lithotomy. So that litho is the same litho here, lithiasis, presence of stones. Um, and those yellow, uh, that yellow gravel looking things, those are it's called like stones that could form in the gallbladder. Usually it's like your body waste like urea that's like free floating in the blood vessel that can like all congregate into like a calcium, some kind of like calcium carbonate crystals. That's what those stones are. Um, and cholelithiasis is one example. Chole, we just said it was like a bile or gall, and plus lithiasis suffix that means the presence of gallstones. So stones can either form in the gallbladder and they can travel through the bile duct into like this area, and like it can get like stuck here, can like prevent bile fluid from like getting secreted. uh, Cholecystose is a combining form that means gallbladder. So kind of like think of it as chole, bile, plus cyst, some kind of cyst that secretes bile fluid. Cholecysto. So cholecysto is a gallbladder, and one example is cholecystectomy. And chol cholecysto plus suffix ectomy, which means surgical removal. That's cholecystectomy, and that is a surgical removal of the gallbladder. And that has to be done usually due to the inflammation of the gallbladder caused by the gallstones, which we were talking about earlier. So, oh, I probably should have mentioned this, I guess, green bulb is the gallbladder. It stores the bile produced by liver, will be stored in gallbladder and then released to the small intestine. And when it's inflamed because of like a gallstone, one way would be removing gallstones directly, but a lot of times, like if that is difficult, we will just like remove the gallbladder, the entirety. Colo or colon O is a combining form that means large intestine, colon, colo. Uh, Colonoscopy, colon O plus suffix scopy. That was visual examination. So that example of colonoscopy is endoscopic examination of the colon. You will insert like a colonoscope through your anus and like keeps going through until, as I was saying, colon is also like a part where a lot of a tumor or cancer could form. So I had contacted that colon polyp, and a lot of times what will it do is, so those scopes a lot of times look like this. It has lens that people can see through actually what's happening. It'll have light because it's dark inside, and it will also have a instrument port for you to like insert any like instrument you want through. It could be, um, I think you guys remember the if you have like obstruction in your blood vessel, you can insert like a catheter balloon through it. You can expand those balloons to like widen the area. Those kind of balloon can like be passed through here. But if it's like a case of polyp, you want to remove it, you might like pass in like a scalpel or like some kind of forceps to like it excise out the polyps through that instrument port. How it usually goes. Um, entero is a combining form that means small intestine. Um, so enteritis is one example. Entero plus itis, inflammation. So inflammation of the small intestine. Um, yeah, so parenteral from like a few lectures ago, parenteral injection. So it's anything para, prefix that means like anything other than something. I'm not sure if that's the exact meaning, but it's like anything other than it. That's something you're referring to. Parenteral, that's small intestine. But in this case, in that case, like it's kind of meaning like a whole digestive tract as a whole. So parenteral, everything except for your digestive tract. Entero, that was small intestine. Esophago is a combining form that means esophagus. So trachea, your windpipe, is for breathing in. Esophagus is basically your food pipe, I would say. You would eat your food through esophagus. It's, as the presenters were saying, like every part of your GI tract is more so just like a muscular wall. Esophagus is also the same. It has like a muscle that like keeps contracting to like bring down the food as it was swallowed down to your stomach. And esophageal viruses. So esophago plus eel, which is a suffix that means pertaining to, and viruses is a complete term that means enlarged veins. And esophageal varices is a dilated veins in the esophagus. So as you can see there, there's blue bulbs and like blue like yeah, the blue bulbs like bulbs popping out of the esophagus. It normally should be like embedded under. That's enlarged vein varices of your esophagus area. And I think in this diagram, it's showing that the liver, when it is having something called cirrhosis, can cause that enlarged vein in the esophagus area. Um, Gastro is a combining form that means stomach, belly. Gastroparesis is one example. Gastro plus suffix paresis. So suffix paresis means partial paralysis of something. So gastroparesis is delayed gastric emptying due to partial paralysis of stomach muscles. So this would more so refer to the sphincter the other presenters were mentioning. So the food comes in, and normally the sphincter should open up, and the food should like pass into your small intestine. But when you have gastroparesis, that pyloric sphincter is kept closed, it's delayed, so food can sit for too long in the stomach, and that can cause like upset stomach. GERD can happen too. GERD is basically huh? Heartburn. Yeah, that's another name for it. Thank you. Yeah, heartburn, and it's if you have too much stuff, or like if your stomach is irritated, then it can like reflux back into your like esophagus, and that acid could irritate your uh, esophageal tract. Um, hepato is a combining form that means liver. So one example is hepatitis. Hepato plus suffix that means itis. I mean inflammation. Suffix itis that means inflammation. So inflammation of the liver, hepatitis. It's usually caused by some kind of infection. So you might have heard hepatitis B, HPV, um, hepatitis A is one too. So hepatitis is an inflammation of the liver, often caused by a virus, and I think it was briefly shown that cirrhosis of liver is a thing. So cirrhosis and what's called like a scarring of your liver. It's also called fibrosis cirrhosis. Yeah, I think that's also called that way. Cirrhosis is it's called scarring, but more like kind of like a hardening of your lung. I mean liver. It uh, lots of cells are like malfunctioning, and it hardens up, so it can't really. Uh, it's like a cluster of like dying cells. Basically, what cirrhosis is. So it's more like your liver gets hardened. That's what cirrhosis is. Yeah. Yeah. I took like a virology class, and I should know this. Yeah, hepatitis A and B. I can search up. Uh, oh, C2. Let's see. Difference between A, B, and C. Um, isn't there like a one chart? Okay. Hepatitis A is an acute infection, and people can improve without treatment. From what I remember, like they are all like different virus caused, and uh, yeah, one causes acute infection. Hepatitis B and C causes a chronic and persistent infection. I know hepatitis B is the one involved in the cirrhosis, and there is a vaccine to prevent Hep A and B, but not one for Hep C. Interesting. Yeah. Transmitted differently. Oh, I see. Oh, yeah. It's like showing right there. A is through fecal oral, and so fecal oral means like when you either ingest or inhale like a fecal particle through your mouth, and could be blood, some kind of fluids for Hep B, and C only for blood. Interesting. Interesting. Yeah. Thanks for pointing it out. Okay. Um, suffix emesis is a suffix that means vomiting. And hematemesis, I didn't even know like this was a thing until I started researching for this. So hematemesis is hemato, combining form blood, plus emesis, vomiting. So it's a vomiting of blood, but what I didn't know about it was when you have hematemesis, you can also have something called melena. So melena is a dark feces containing partly digested blood. So it would be different from like a bloody poop. It's more like those bloods were already digested, so it can't come out as like a yellow brownish feces. So if you have like a internal GI bleeding, you can have vomit bloods at the same time. Those blood can be digested and then like go down all the way down the GI tract and become melena. So that was hematemesis, vomiting of blood. And suffix pepsia. Um, suffix pepsia is a suffix that means digest or digestion. So dyspepsia. Dice was like bad or difficult or something. So dyspepsia is indigestion, difficulty digesting. And pepsin uh, probably derives from the same roots as the suffix pepsia. So pepsin is a important digestive enzyme that's secreted in your stomach that is involved in breaking down the proteins into smaller chunks. Pepsia. And suffix phagia means eating or swallowing. So one example is dysphagia. Dice is a prefix that means difficult. So we were talking, and plus phagia, so difficulty swallowing. So it could be the case that when you're like normally swallowing, the food just should go straight to the esophagus. But when you have dysphagia, it might accidentally kind of slip into your trachea because your epiglottis, so that's like the portion of your esophagus that's involved in deciding which one goes to the esophagus or the trachea. It might accidentally enter the windpipe, I mean the trachea, and that could be a problem. That phag part, you remember the phagosome from Dr. Portnoy's lecture, or macrophage? Those phag part also means like eating or swallowing, because phagosome is basically, I think it would be nice to. Yeah, they actually like protrude their like membrane to actually like engulf it in. I think I kind of want to show the. Oh, yeah, as you're saying, like bacterium or virus, any kind of like engines, they'll literally like um, detect and kind of engulf in with the membrane just surrounding it, and the parts they were in kind of becomes a like a vesicle that's like floating inside your um, cell. Oh shoot! Okay, okay, almost done. Linguo is a combining form that means tongue. So one example is sublingual. So sub is a prefix that means under something. Lingual plus al, suffix that means pertaining to. So sublingual is basically under your tongue. So this area is sublingual, and sublingual is usually referred to as like a route of drug administration. You will place your drug like under your tongue. That's one of the areas where the membrane is very close to your internal system. So it gets absorbed pretty fast if you put sublingual. Oh yeah, placed under the tongue for rapid absorption. And there's also some oral route called buccal. So sublingual was under the tongue. Buccal is more like towards your cheek, in the inner side of your cheek, like that area. That is also one part where um, the medication can get absorbed fast. But if I remember right, sublingual is faster absorption. So for the time being, I will not do the case report for review, but this one I remember was one of the more like interesting cases. I think this one and the first osteoporosis one were my favorite case reports. So yeah, I hope you guys enjoy. And I will send out the announcements through B courses as well. But case report 5, as usual, due next Monday. And next week is the urinary and reproductive system. So whoever's presenting, please get ready. And oh, if you haven't yet, please fill out the attendance sheet.
Thank you.
Yeah, thank you.